Good morning, anatomy students. Wow, what a great couple days with the weather. Yesterday, excellent. The coffee is brewing in the background, and we're going to get a COVID 19 update today. And I'll share this update for both Wednesday, April 29th, and U White days. We'll see this also tomorrow on Thursday, May 30th. I wanted to start with the Johns Hopkins website real quick and just show you we hit a number yesterday. Um, the United States did over 1 million positive cases in the U.S. Then the curve, the overall worldwide curve, is it flattening? Maybe a little bit, but it kind of looks the same as what we've seen for the last 3 months, 4 months. Let's go to Indiana, and you can see Indiana's added some stuff to the website. New positive cases 650, but that's over a 3-day period. 57 deaths in an 11-day period. We're still testing people. Indiana's up to 901 deaths. The map, you can see the Indianapolis area by far has been the hardest hit. 5,080 cases, 282 deaths. Delaware County, 152, 13 deaths. That number is always a little bit different than what the Star Press is reporting. And then you can see they've added some graphs, positive cases by day, demographics. I'm not really going to go through those. We've talked about ICU beds, ventilators, probable COVID 19 counts. So I don't know what that is. I guess I could hit this eye. Oh, I see. People who died probably of COVID 19, but we're not sure. So that would add to our total. And then, no doubt about it, nursing homes have been hit the hardest. So, long-term care facilities, nursing homes, unfortunately, is where the virus has impacted the most people worldwide. I want to take you to this website, the IHME. IHME um, is a website that has done all these projections. And at first, they projected 2 million people in the U.S. would die, and then they cut that back to 200,000, and then it was 100,000, and then it was 80,000 people, and then it was 60,000. And I just wanted to take a look at this. This website, this entity predicted that we hit our peak in deaths 14 days ago. And you can see kind of it's not a pretty graph as far as deaths per day go, but it certainly has dropped over the last couple days, where we hit our peak at 2,694 deaths, and 2 days ago we cut that in half, 1,303 deaths. The website doesn't update very often, unfortunately. I wish. This said projected on April 29th or April 30th. I mean, we can look, I guess, and it says today 1,438 projection, tomorrow, Thursday, 1,322 projected. Hospital use, you can see we hit our peak in bed usage, ventilator usage, ICU bed usage, back on the 19th of April. Total deaths, this has gone up. in the last couple days. So it was around 60,000 a week ago, and now we're back up to 72,860. And one can assume that the science behind this, they're saying since states are starting to open up, the death rate will increase a little bit again. So we've gone up about 12,000. Projection. That's a projection. Now, interestingly, let's go to Indiana. And you can see all the information. Seems like it's been forever. We started closing businesses on March 16th. That was the first day we did not go to school. No mass gatherings March 12th. Stay at home order March 25th. All schools in the state closed March 19th. So we were early, 3 days earlier than everyone else in making that decision. The projection was that we hit our peak 8 days ago. But man, this Indiana graph is so sloppy in terms of deaths per day. So it's not a pretty graph. So yesterday, 31 deaths. Today, projected 27, 25, and then really disappearing by mid-May. So one of the main things I want to show you on this is this group, the IHME, states that after May 22nd, social distancing can be relaxed. More testing, contact tracing, that means if someone knows they have it, you trace back everyone that they've interacted with personally, isolation, and limiting gathering size. So I wanted to come out with this video today because the governor is going to give his new orders on Friday, May 1st, so in a couple days. This website is saying May 22nd. I predict that the governor will definitely open up some parts of the state this Friday. I don't know what he'll open up. I don't know if restaurants will be open up with 25% capacity. Our lockdown order, I think, will be eased. I think more businesses will be opened up on Friday. Compare that to what this website, what the IHME says, May 22nd is really the best date to do this. Total deaths on April 27th, 844. And now, about a week ago, the projection was 900. So we've added about 100 deaths, and they think that will level off by May 22nd. So they're saying May 22nd is when all deaths will stop from this disease in Indiana, according to their data. So I think that's interesting and exciting. That we'll see what happens Friday, and I'll try to come out with a video next week, kind of outlining what the governor says and where we're at with this disease. I hope you have a great day, and I'll talk to you all later.